Hi, my name is Kyle Coates. I'm a certified athletic trainer for Schneck Medical Center. Millions of athletes will participate in baseball and softball this spring and summer. The most common types of injuries that occur in these athletes are arm injuries that include shoulder and elbow pain. In this video, we will provide information about recognition and prevention of these types of injuries.
Hello, I am Dr. Jill Mikles of Schneck Orthopedics in Sports Medicine. I am a board-certified orthopedic surgeon with fellowship training in sports medicine and sports injuries. It is my pleasure to discuss with you today common injuries seen in throwing athletes and the treatment for these injuries. There are millions of young athletes participating in throwing sports. Baseball and softball have ranked as the third and fourth most popular high school sports for boys and girls, respectively. Many athletes play multiple positions and participate on more than one team yearly, contributing to arm fatigue and the risk of overuse injuries. The shoulder joint is the most frequently injured, followed by the elbow. Baseball pitchers tend to suffer the most severe injuries, requiring the greatest number of days lost from practice or competition. Adolescent athletes, ages 11 to 15, present a particular challenge when injured. The growth plates, or physes, are still open and developing in athletes this age. The combination of repetitive throwing, weak physeal cartilage at growth centers, muscle tightness associated with rapid bone growth, increased laxity of soft tissue structures, and decreased development of neuromuscular movement patterns may place the adolescent athlete at increased risk of upper extremity injury. Injuries commonly seen in adult throwing shoulder include internal impingement, irritation of the undersurface of the rotator cuff, and superior labral anterior-posterior tears, or better known as slap tears. These injuries, although possible, fortunately are less common in younger athletes. Anterior-superior shoulder pain related to rotator cuff biceps irritation, labral pathology, and/or proximal humeral epiphyseal injury, better known as little league shoulder, are the more common complaints in the 11 to 16-year-old throwing athletes. Fortunately, the treatment for little league shoulder and most shoulder injuries in the adolescent thrower is non-surgical. Rest of an overuse arm is critical to decrease inflammation, and physical therapy is helpful to gently increase range of motion and flexibility. The average time for returning to play is 4 months. There is lower risk of permanent injury, but continuing to play with little league shoulder could lead to growth arrest or angular deformity at the shoulder. The shoulder needs to be rested until activities can be done pain-free. Sometimes it is necessary for a player to change field positions after returning to play. Older athletes that do not respond to this treatment may require a MRI and further treatment with medication, injections, and possibly surgery. Repetitive throwing causes a tensile stress on the medial elbow and a compressive force at the lateral elbow. Injury can occur medially at the ulnar collateral ligament, or UCL. This is the injury associated with the infamous Tommy John's procedure, which is a surgery to reconstruct the UCL. UCL reconstructions have doubled in high school baseball players since the early 2000s. However, UCL injuries is not the most frequent injury sustained by the youngest throwers. Medial epicondylar hypophysitis, or little leaguer elbow, is the most common. This is the irritation of the growth plate at the elbow from overuse. The treatment for little league elbow is similar to little league shoulder: rest, activity modification, and physical therapy. Typically, I will recommend complete rest for 4 to 6 weeks, and if pain-free, athletes may begin physical therapy and initiate a gradual return to throwing program over the subsequent 6 weeks. If ignored, this can lead to fragmentation and avulsion near the apophysis, which could require more extensive treatment, such as surgery. Unfortunately, recurrence rates are high and may require management that is even more conservative, meaning slower and longer to recovery and return to play. Little league shoulder and elbow injuries will resolve once the growth plates fuse. Older athletes may require a MRI to evaluate the ulnar collateral ligament. High-level throwers that want to continue competitive sports may require an ulnar collateral ligament reconstruction surgery. Compressive forces at the elbow with throwing can cause lateral elbow pain. This can lead to osteochondritis dissecans of the elbow, which is the disruption of blood flow to the bone and the cartilage in the elbow, causing damage to the cartilage in the elbow. Those injuries with a stable cartilage lesion can be treated non-operatively. There is a 90% success rate with this treatment. Cartilage defects that are unstable may require surgery, and throwing can be resumed 4 to 6 months after the procedure. The most effective way to treat throwing injuries is prevention. Proper conditioning, technique, and recovery time can help prevent injury. This is the main objective of our video, to keep you out of my office and on the field. Continue watching for more information. I hope to see you at the ballpark.
The essentials to a proper warm-up include dynamic warm-up, pre-throw warm-up, and then lastly post-throw stretching. So we're going to demonstrate some dynamic warm-up. These can be used with resistance bands. Some of the most common resistance bands can be attached to a netting or to a fence. And these come in sizes from youth all the way up to adult and your high school age throwing athlete. So to start off with, we're going to attach the band about shoulder height to the athlete and have them move away so that they have some slight resistance. So he's going to start off with just some simple forward flies. This helps warm up the front of the chest, front of the shoulders, and he's just going to move his hands gently together and perform about 10 of each of these types of exercises. Okay, after that he's going to move to reverse flies. So he's going to be going the opposite direction, and by doing this he's going to warm up the back of his shoulders. So he's just going in that reverse fly motion, squeezing his shoulder blades together, trying to warm up the back of his shoulder. Okay, the next exercise is external rotation. So he's going to use his throwing arm, and he's going to use his opposite arm as a pivot point and move into external rotation with his shoulder. So this helps warm up part of the rotator cuff muscles, mostly involved in throwing. Okay, the next is internal rotation. Internal rotation, again, works on the rotator cuff muscles involved in throwing. So he's going to use that pivot point again to move the arm forward. Next is the throwing motion. So he's going to mimic that throwing motion with resistance of the band. So this really helps get the arm warmed up and ready to throw with proper mechanics. Okay, the next one is tricep extension. So he's going to use resistance by just doing a chopping motion with his arms and get those triceps on both arms ready to throw. So following the dynamic warm-up, the next step should be the pre-throw warm-up. So this is done with the athlete and a partner, and they're going to take a baseball, and it's basically partner throwing, starting at a short distance, approximately 10 feet away, with just simple flips and tossing back and forth. And then slowly the athletes will move farther and farther away, focusing on mechanics, and then slowly throwing harder at distances until they feel that they're appropriately warmed up and ready for their game or their practice. Okay, after games or practices, another essential part for the athletes would be a post-throw stretching program or routine. The post-throw stretching is to increase flexibility, also decrease soreness. This should be done immediately following games. Can also be done hours later if the athlete has any kind of soreness in their shoulder, elbow, or forearm. Some simple stretching exercises that they can perform. The first one is for forearm flexion. So the athlete will take their throwing arm and place it into flexion. So go ahead and grab that. And they're going to gently pull down until they feel a stretch on the top of the forearm. And they're going to hold these stretches anywhere from 30 seconds up to a minute. And you'll repeat these at least 2 to 3 times. Okay, the next stretch, they're going to flip that arm over and pull down on their hand. So in this stretch, you should feel this more on the bottom of the forearm. Again, you're going to keep that elbow as straight as you can get it so that you can feel a stretch all through the forearm and the bicep. Okay, the next stretch will be pronation. So they're going to take their thumb and point it inward and hold that hand kind of in a downward position. And they're going to feel that stretch kind of along the back side of their shoulder, maybe even in their tricep and forearm. The next stretch will be supination. So they're going to twist that hand around, thumb pointing outward. Go ahead and grab there. And they're going to feel that stretch along top of their bicep inside of their forearm area. Again, just kind of pulling a gentle stretch until you feel that muscle pull. Okay, the next stretch, these can be done with a partner, sometimes up against a wall or a pole, something that provides a little bit of resistance. So first we're going to go into external rotation. So we're just pulling the arm gently backwards, kind of giving a little support to the back of the shoulder and just gently pulling back till he feels a stretch on the front of his shoulder. Again, we're going to hold these for about 30 to 60 seconds. Okay, the next stretch we're going to go into is internal rotation. So we're gently pushing on the front of the arm and providing that resistance or support to the back, and then just pushing inwards. They're going to feel this stretch more on the front of their shoulder. Okay, and then lastly, we're going to go into tricep extension. So we're going to pull that arm over their head into extension and then gently pull down on the back of their arm. They're going to feel that stretch all along the back of their shoulder, up behind their armpit area, and then into their tricep. In summary, the athlete should perform the dynamic resistance band warm-up, the pre-throw warm-up, and then lastly, the post-throw stretching to help prevent injury and also reduce pain.
Hello, I'm Jeremy Richey, head baseball coach at Seymour High School. A little background on me: 1999 graduate of Seymour High School. I played baseball and football here. Went on to the University of the Cumberlands and played both football and baseball down there, and I transferred and finished up my baseball career at IU Southeast. Was an assistant coach from 2003 to 2011 and became the head coach in 2012. I think the most important thing with handling pitching staff at that level is to use a lot of pitchers. Involve as many of them as you can. It benefits the kids because there's not as much workload on them, and it also puts some kids in some positions to be able to get some work in. And the more kids that we have pitching, the better it's going to be in the long run, because we don't know what kind of experiences are going to happen from there. Are they all going to play baseball in high school? Are they going to go do something else? So I think the biggest thing is to have a few drills that you're going to work on to make sure that they're not hurting themselves, and have as many kids on your team pitch as possible. Number one is overuse. They're throwing too many pitches, maybe on game day, or not giving the proper recovery time coming back off of that. Another one is pitcher to catcher and then catcher to pitcher. We want to make sure that whatever they're doing on that day, it's one or the other, and not doing both of them. But I think the overuse is the biggest one at that age, because usually they have one or two really good pitchers on each team, and they want to kind of ride those guys out. But we've got to make sure that we're making decisions that are what's best for the kid, and not necessarily what it's going to take for us to win a youth league game. Around the age of 12 is usually the number that you will see. It varies with a kid. It depends on their physical ability. Some kids mature quicker. It depends on who is starting the process of teaching them how to throw a curveball. If it is somebody that is experienced and understands the proper ways to throw it, that can influence them to maybe start a little bit earlier. Because there's a couple reasons why curveballs at an early age are not ideal. Number one is maybe the arm is not physically ready for what it takes to throw a curveball. And number two, most of the time at that age, the curveballs they're throwing are not curveballs that are going to be effective in the future. They see a lot of the ball goes up and down because they slow their arm down, and it just becomes a looping pitch instead of a curveball, because the true curveball is thrown with the same arm speed as a fastball, and then at the end is where the curve takes place. So it's a benefit to start later, especially if the parent or the coach doesn't have enough knowledge of how to teach it, because of safety and also because of effectiveness. We get kids that come to high school a lot, and they have this really slow curveball that is not a productive curveball at this level, but they've been throwing it that way because when they first started, they slow all their mechanics down, and they think that that's a good curveball. So the number would be 12, around there, but obviously it can be a little bit earlier than that. Not much, but there's nothing wrong with going a little bit later than that, because the changeup at that age is probably more effective than the curveball anyways, because it should look like a fastball. I think the changeup is something that earlier that players are are doing that or learning how to throw that, the better it's going to be for them in the long run. You know, I'm one of those that unfortunately didn't get a changeup until I was a junior in college. I got away with throwing hard and having a curveball that was pretty good, but when you get to college, you know, I was kind of exposed a little bit because I didn't have that changeup. But at the lower levels especially, a changeup can be really effective because, like I said, if you throw it correctly, it's going to look like a fastball because it's not going to have any upward movement or really sharp break that will give away that it's a curveball. And because of the safety of the changeup, because you're not doing anything mechanically different with a changeup compared to a curveball. And then the mechanical things, a big issue at that age is the kids who throw hard, they usually have more strikeouts, which then leads to coaches and players thinking that is effectiveness. So what they do is they try to throw too hard and their front shoulder flies open. And when that happens, you know, now they have momentum working against them. And also it can, you know, the timing of the mechanics, you know, maybe the lower half is not being used as much because they've changed their mechanics to try to throw the ball too hard. And that's a tough thing for young kids because, you know, we want kids that can throw hard. Velocity at any level is going to lead to better opportunities to be successful, but we want to make sure that we're doing that correctly. And the front shoulder flying open kind of puts some pressure on shoulder and even elbow that could cause some problems down the road. It may not be an immediate problem, but down the road that's going to happen. And then also being able to use the mechanics in the right timing so that the lower half is being used also, because it's going to take less stress off of the arm. In season, once again, for us even, it starts with the idea of overuse, making sure that we are not making them throw too much. And I'm a believer that game day is not nearly as big of an issue as coming back off of game day. So if we have a starting pitcher who throws on Monday, you know, 120 is the maximum we can throw at the high school level in the state of Indiana. And 120 is a lot. But you get into the 100 area, I'm not too worried about that on the game day because their body is moving. They've thrown a lot. They're still in the right frame of mind. But what happens after that day is a lot bigger deal for us. And we're fortunate that the IHSAA, they created a numbering system. If you throw this many pitches, then you have to not pitch this many days, which is also happening in youth leagues now with Pitch Smart. They give you a really nice chart, and it goes all the way down to the lower levels of 9 years old. If you throw this much as a 9-year-old, you have to wait this many days until you pitch again. So a lot of it starts with us is what does that look like after that game day? So we get a kid that throws 100 pitches. We know that he can't throw for 4 days. So some of the stuff that we're going to do after that is that we're going to have them do sprints. You know, the faster the arms are moving, the more that the blood is flowing through there, which will limit some of their soreness. We're going to do the J bands, the Jaeger bands is what they're called, and that's working its way in Seymour all the way down to the lower levels also, because that set of drills with the J bands does a lot for shoulder issues. And you know, at the high school, we're blessed that we have spent a lot of money on some things that allow us to have a routine on what it looks like each day, and especially in the off season, because we believe that in the off season we have to build strength with the arm, and that requires heavy balls, it requires plyo balls, J bands. We've got these rebounders that we use. And we've got the blades that we use. So all of those things factor into our in season, but it also is a big part of our off season, because to get the arm ready, that out of season program has to stretch the kids. And long toss is a big one. Long toss is something that we can do with a baseball and a partner. So obviously the easiest thing to do to want to build some of that strength in a program is to long toss and try to throw the ball as far as you can. And then as you're working back towards your partner, keeping the ball on a line to help with release point and things. But we're blessed here because we have developed a lot, and we work with Kyle a lot on programs and different activities for them to do and different stretches. You know, a big thing is the stretching to be a baseball player is longer than it is for other sports, because so much of it goes into our arm. So our daily throwing drills, we tie those into it, and we do those out of season also. So there's just a lot of different things that we do that we have access to, but at the lowest levels, playing long toss and throwing every day. That's one of the things that a misconception at the lower levels is, if I pitch today, then I don't want to touch a ball for 2 or 3 days to recover. Well, that doesn't lead to recovery. That leads to soreness sticking in the arm, and we need to throw every day, but we can't pitch every day. And there's definitely a difference in that. So in season is not a whole lot different. We may not long toss as much in season as we do out of season. And heavy balls really kind of go away, but some of our plyo ball drills, they go into the season as well. In closing, the one thing that I would add is, for all of you youth league coaches and parents, make sure that there's some communication between parents and youth coaches on how much they threw during the weekend. Baseball is a unique sport where oftentimes our kids are playing during the week in our youth leagues, and then they're playing travel ball tournaments on the weekends. So we want to make sure that communication takes place. It would be nice if it's the travel coach, if it's a local group where they can say, here's how much all of our kids threw this weekend. But if that's not the case, then parents definitely need to be proactive with their kids, so that the coaches of the youth league understand how much they threw that weekend, because we don't want to have a kid throw a bunch on Saturday and Sunday and then a youth league game on Monday or Tuesday, and nobody communicates, and that kid goes out there and throws more than he should, and probably shouldn't have thrown at all based on how much they threw. So I do caution you to have communication with youth league coaches or parents to make sure that everybody understands how much that pitcher threw the weekend leading into the youth league.